I'm Philip Ward, Editor-in-Chief of Art Mini Europe. Everyone in radiology loves a people story, a human interest story, and I think with Dr. Weidekamm we have a great human interest story that she has made the switch from Vienna to New Zealand. And Claudia, I thank you very much for joining us.
Welcome.
I was going to ask how when did you decide to make the move? When did you make the switch to New Zealand?
Yeah, it was actually in 2015, so a bit more than like 3 years ago, that I decided I want to just have a new experience. And not that I was bored here, but it was more like there's more in my life that I can achieve. And I also wanted my girls to learn English as well. And I thought I want to move to an English-speaking country, and actually looked at the UK. The weather conditions weren't so great in the UK, so that was like an exclusion criteria. Canada was on my list, and Australia is quite hard to work actually when you're from Europe and not trained in Australia. So that was also not an option for me, and I thought, why not New Zealand? And so that was one of my decisions makers. So New Zealand is a lovely country, provides a really good lifestyle as well.
So which balance. Hospital are you in?
So I'm
could you just describe the hospital that you're at?
So I'm having a mixture of like a public and a hospital work mix. So it's 2 days at the North Shore Hospital, which is part of the University Hospital, and 2 days in the private practice. And it's actually a real good mixture of the work, because in the private practice for sure we do more MSK cases, in particular lots of like MRI and ultrasound examinations, whereas like more the emergency things are covered in general radiology at the hospital.
Okay.
Yeah.
Now what would you say are the major differences between working in Vienna and working in New Zealand?
So in Austria, the radiologists are usually doing the ultrasound examinations, whereas in New Zealand we have sonographers. That was one of the first things I struggled with a little bit, because you have to build up a trust with the sonographers. You look at the images they perform, sometimes you don't have the chance to actually see the patients. In my opinion, for the ultrasound examination, it's very, very important that you do a little bit of a clinical examination as well, so which kind of like confirms your maybe imaging findings. And this is the part that has to be skipped when you work in New Zealand, unless you ask the sonographers, please call the patient back and I want to look at the patient as well, or ask a couple of questions. So you can kind of like treat with this when you train the sonographers and say, please tell me about this and this findings of the patients. Is there a limited range of movement? And just give a bit of more like a clinical history as well, and not just do the pure ultrasound examination.
I mean, you're very much involved in sports imaging and imaging of sports injuries, and I suppose you get a lot more cases in New Zealand compared to Vienna, perhaps.
Sports is a big topic in New Zealand. Almost everybody is super sporty, in my opinion.
Have you had to expand your knowledge of certain sports, perhaps that you didn't know about when you went there?
Rugby is the national sports in New Zealand for sure, and it's crazy what happens to these rugby players and how tough they are. So they just finish the game, although they have broken knees and everything. It's really ridiculous how they treat with it.
Yeah.
So we see very, very severe injuries in the acute setting, and this is also something which is quite important, that we actually make comment on, is it an acute or a chronic pathology? What we see in our report, that this is referred usually to the reimbursement by the insurance system. So if it's like an acute finding which is related to a trauma, then it's all covered by the ACC, which is like the Accident Compensation Corporation.
Now, you're also through MSK Ultrasound, you're very involved in the educational process. Could you just mention about some of these that are coming up? I think you have a couple of workshops in the pipeline that you're working on.
Yeah, well, in Vienna we run ultrasound courses over the last 10 years, very successful, and have an interdisciplinary ultrasound course where orthopedic surgeons are giving lectures together with the radiologists, and then we train the delegates with hands-on sessions and workshops, and which is really good. And more or less this concept is copied, and I now do my first ultrasound course and MRI course in Auckland in 3 weeks' time.
Excellent. Yeah. Well, best of luck with those. Obviously, our viewers can look at those. And how many in terms of numbers? 40, 50, something like that?
Yeah, because we want to provide a high quality, we have just limited spaces, but there are some spaces left, and we say, okay, 45 is our threshold to accept participants. Yeah.
Excellent. Well, I wish you every success with that.
Thank
Enjoy
you.
the rest of the Congress, and thank you for being with us.
Thank you.